95.4% meta-analysis survey that was done of peer-reviewed literature.
If you could put the microphone on again.
I am familiar with the article. Certainly not as familiar as Dr. Solomon, however.
Okay, well, you may not be able to answer my questions, but the questions that I have about it is, would you agree that the surgeons who publish in the peer-reviewed literature are generally surgeons that perform better screening? They're more conservative than the average LASIK surgeon, say someone who operates at a high-volume LASIK center? Or another way to ask it is, would you agree that there's no evidence to support that the studies retained in the meta-analysis are representative of the standard of care?
Yeah. I would suggest that well-trained LASIK surgeons can routinely achieve the results that were obtained in the meta-analysis, and that the results probably underestimate the quality of results, since most of these results were obtained with older technology, using methodology that we no longer use today. And I would suggest that the results we see today are far better than the ones that Dr. Solomon presented.
I don't think you answered the part of my question about the type of doctors that publish in the peer-reviewed literature versus the doctors that do not.
As far as the quality of doctors performing laser surgery, I would suggest that there are always going to be doctors who are better and doctors who are not as good. And I think it's important to suggest that patients who look for laser surgery look for the best possible doctors to perform their surgery. I can't really comment on doctors who don't publish.
I understand. I was just interested in your opinion. I have another question. In the meta-analysis that was published, do you believe that they're suggesting that the complication rate can be derived by subtracting the percentage of satisfied patients from 100%? In other words, are we looking at a 4% complication rate based on a 95% or 95.4% satisfaction rate?
Absolutely not. It's impossible to suggest that complications and satisfaction have a one-to-one relationship. It's a very difficult area to evaluate.
Okay, and do you know overall how far out the satisfaction surveys track the patients in the meta-analysis?
The meta-analysis involved literally hundreds of studies that were evaluated, and some of the studies were as short as 3 months, but others went out to years of follow-up.
Thank you. And one last question. Is it true that the patients that are told that complications of LASIK, such as dry eyes, night vision impairment, these complications will resolve with time? And the reason I'm wording it that way is if a patient was surveyed at 6 months and this patient had night vision impairment or dry eyes, do you think it's possible that they would answer that they're satisfied with their visual outcome because they're believing at 6 months they're expecting these complications to resolve? So you think that is a factor in these surveys?
I'm not an expert in epidemiology, but I can say, from having cared for tens of thousands of patients, that patients do not say they're satisfied when they are unhappy, expecting to be satisfied in the future. Patients who are unhappy will generally voice their opinions at every step of the way.
Actually, I did have one more question. I'm sorry I missed it. Is that okay?
Can we make this the last question that you have for Dr. Donnenfeld?
Just one more question. Did the study, which I've only seen the press release, I haven't actually seen the data, but did the study, the 95.4% meta-analysis study, did it report the percentage of patients that were experiencing dry eyes and night vision impairment in the studies?
I can address the dry eye aspect. I was part of that. And in the meta-analysis, I believe it was 35% of patients reported dry eye following their LASIK surgery, and 32% of patients reported dry eye prior to their surgery. So that dry eye does occur after surgery. It's a very common problem that we see. Probably 1 in 4 adult individuals in the United States experiences some form of dry eye. So that it does occur after surgery, as it does occur before surgery as well, and that at times laser surgery can make dry eyes worse.
Any information on the night vision impairment?
I could not quote it, I'm sorry.
Thank you very much. Do any other members of the panel have any questions for the public speakers? Is Dr. Schallhorn here? Because I have a question. Has he left already? Ah, great. What we've heard from many of the patients here who have had adverse effects after LASIK are, I think, very, very bad effects. What percentage of patients from the studies that you have reviewed or been participating in would have this severity of effects?
The studies that I've conducted, the type of people that are very, very disabled, it's very, very rare. So, to have the levels of disability that we've heard today is a very rare occurrence.
So when you say very rare, would you say from the studies less than 1%?
Well, I would say much less than 1%.
Okay. And the reason I'm asking that for the patients in the room is there are two aspects that the panel needs and that everyone here needs to sort of understand the full complexion of this. And one is certainly what is happening in the real world and what isn't good that the FDA and that perhaps organized medicine can do something about. And then two, individual stories are compelling, but we need to also, as a panel, put it into perspective. If we could get all the patients in the United States here who've had LASIK, how many would fall on one side or another to try to get some balanced viewpoint? Thank you. Does anyone? Yes, Mr. Bonner.
Richard Bunner, consumer representative. I just have a question, perhaps for one of the physicians in the room. When a patient's really trying to attain informed consent, when does the option of a second opinion ever come into play? Are they encouraged to seek second opinions? And has anybody had any experience in evaluating a patient to encourage them to receive a second opinion prior to making a decision on LASIK surgery?
Well, I think any of it. This is a standard of practice, and every individual physician would answer themselves. But I think typically patients are only offered a second opinion if there is